With many governments considering imposing new lockdowns or mask mandates as a result of a resurgence of the COVID virus, Washington County Commissioners want to make sure that they are upholding the Constitution as well as supporting citizens' rights to make their own decisions.
And I do want to remind everyone that your rights do not come from the government, and therefore the government can't take away something because it didn't give them to you. They are inalienable rights.
Washington County Commissioners passed an ordinance and policy against these mandates.
Individuals are encouraged to make educated personal health care decisions to continue to slow the spread of the COVID virus. It is further resolved that Washington County will not support nor impose any economic lockdowns or mask mandates.
After reading the resolution, commissioners heard from those who support it for various reasons, including the 5-county Southwest Utah Public Health Director.
We all have had a responsibility to understand what this virus means, what it can mean for others, what it can mean for those around us, who we expose. And so having that kind of understanding has really always been a goal of the health department.
Having said that, Dr. Blodgett mentioned there could be consequences of some actions.
We see some very interesting dichotomies, right? We have a very effective vaccine, one that we recommend wholeheartedly, and yet a significant portion of the population not vaccinated. And so those are decisions people are allowed to make, but I think we often make decisions, and then the consequences of those decisions are not things we get to make, right?
I fully support your message. I wear a mask because I have personal reasons, with health reasons, that caused me to try and be careful. I caught COVID back in February, even though I was trying to be careful and wear a mask and use the stuff. I'm right in the middle of chemo treatment and radiation. Made it through it, but I also feel that it's my personal responsibility. So,
as a county commission, we've trusted the people. The people have trusted us, and we've trusted the people to make the decision to elect us. And we trust the people to take good information and make good decisions for themselves.
And from a law enforcement standpoint, I want to just make sure everyone is aware that the Washington County Sheriff's Office has no interest in supporting a mandatory mask mandate in this county. And I'm glad that the commissioners kind of see it, or at least I hope you see it the same way, that personal choice is much better than forced compliance.
Commissioners felt it necessary to put the action on paper to allow decisions to come from individuals and not the law.
Whereas in Washington County, we believe that individuals should educate themselves, consult with their personal physicians, and make their own healthcare choices. Whereas lockdowns have been shown to have negative impacts on economies and individuals' mental health. Whereas individuals can take steps to protect themselves from COVID, including receiving a vaccine, wearing a mask, maintaining physical separation, and other measures.
Dr. Blodgett said while there are COVID variants, unlike the flu, COVID is a fairly stable virus, with the highest risk still being those age 85 and older, and those younger are still the least impacted.
Until you get down to below 50, and then the fatality rate for influenza every year is higher at every age point than for coronavirus for every age point below the age of 50. So.
And he said the chances of being hospitalized are also lower than one might think.
The real number is 1 to 3%, depending on which data set you're looking at. And so I think people have a not very clear picture of how likely you are to end up in the hospital. We're just talking about a sheer volume, right? When you have 1% and you have 4,000 cases a day, that's, that starts to add up as people in the hospital. But as far as individual risk, I think it's important to understand. So once you get into that under 18 group, in the last 3 years from influenza, we had 3 deaths in the under 18 age range from influenza. From COVID, we had 1 in all 3 of those flu seasons.
And it's interesting that when you're up against tough times, there's a tendency or a temptation for those in a position of power to want to exercise that power in a way that tells people what to be doing. And throughout Dr. Blodgett has been consistent in the message that he shared today, in that public health does best when it educates and empowers people.
We don't want anyone to twist our words or this resolution to think for a moment that our hearts don't go out to anyone who lost a loved one, because this was very difficult. And as we all scrambled to deal with what they had to guess how to best fight it, whether at the hospital, at the ICU, at home where so many people just stayed and toughed it out, and some also may have passed away there. I know of one in particular in our neighborhood. We are in no way less sensitive to those who struggled and lost loved ones because of that.
Almquist reminded the public they should still take precautions, especially if they are sick. The resolution and policy was unanimously passed by commissioners. For more information on virus precautions, you can go to swuhealth.org. In Washington County, Melissa Anderson, Community Education News.
Passes.